Hello people, in this video let us look at this human embryology book by Chaurasia, PD Chaurasia, with multiple choice questions they are saying. So let us look at this book. The thing is, the other Chaurasia books, right, they have everything like surface anatomy, spotters, osteology, histology, dissection, everything it has, but only embryology part was missing in the Chaurasia books, right? So let us see, for embryology they seem to have given a separate book. So general embryology, all the fertilization and all that, then coming to how the development happens week by week that they have shown here. Then systemic embryology, specific things how they develop. Let us say the heart. You want to know how the heart develops, right? Then you have to come to this chapter, development of the cardiovascular system. So you should know how the septum, ventricular septum, how it develops. So you should know the parts of the intraventricular septum. So you will know the type of defects, ventricular septal defects, whether they are membranous, etc., which is more common. All that, those defects you will come to know. So that is what is the importance of embryology. You will know that what anomalies to expect in a person, especially a child, a newborn, right? Then you have some applied embryology, they are telling. Multiple choice questions. So that is the content of this book. So overall, the book looks simple. This is the one I was talking about, right? The ventricles and the ventricular septum, how it develops. The kidneys ascend, right? What else descend? The thyroid descends, the testicles descend. And based on the development, if you know how it develops, you know what anomalies to expect. This is teratology, that is what can cause abnormal development. So there are some teratogens, which can be even microorganisms, some drugs, etc., right? So some that's why they ask pregnant women to avoid any chemical or drugs, right? X-rays are also teratogenic. So that's what they're trying to give here. This is a pedigree chart, those symbols, notations, and those X-linked disorders, Y-linked disorders. This is dominant, you can see, because there are no carriers in this. In this you can see carriers. As soon as you see carriers, you can see, and the two, both male and female are affected. So this is a carrier state is present. So this is a recessive condition, right? So that much dominant recessive you can know of very immediately. Then MCQs, which would be interesting. We'll take an MCQ and see. All of the following structures are formed from mesoderm except, this looks a little complex, gametes, bladder, suprarenal cortex, prostatic utricle. So the answer is here, chapter 4, 1 is D. So chapter 4, 1 is gametes in both sexes are not from mesoderm. Everything else is from mesoderm. So you'll have to find out from which derm is this, from which germ layer is this. Now let us look at some images. What do you see here? Anomalies of the midgut rotation. So they have shown you that here there is no rotation. So you know normal how it should look, right? I wish they had put a diagram here for the normal. Well, nearby any of this page I couldn't find it, but anyways you can see that this one is non-rotation. Then this is reversed rotation. And the third part of the duodenum comes to lie in front of the vessels. So here they have shown some diagram here. So this is a advanced stage of an embryo. Okay, so they did not, in this diagram, as you see, they have not mentioned the weeks. One thing, they should mention the weeks according to me. Then they should also mention which is the superior, inferior, lateral, medial. What am I saying? this is the right view or the left view, something, like a slice of how you have taken the slice. One 3D image, if it was here, it would have been easy to understand. However, in this diagram, I can still make out that this is the cranial side, right? And this looks like the caudal side, right? So basically here, what are they trying to show you? The pharynx. Primordium of pharynx extending from the buccopharyngeal membrane to the tracheobronchial diverticulum. One thing should be common, it should be like this is a left side view, right? They should retain the left side view throughout. That would be good. I would have more preferred the right view and the right side anatomy, embryology. So here they are showing you what are these. These are the dermatomes, is it? Limb buds, okay. Look at this diagram, guys. This is the fetal circulation. Very important to understand that the blue here, what you're seeing, the umbilical vein, though it is marked as vein and though it is blue, it is actually carrying oxygenated blood, and it will directly supply this oxygenated blood into the heart. So in this case, the oxygen is coming from the umbilical vein, not from the lungs, you understand, in the fetus. And the mother is giving only the oxygen, she is not giving the blood. So the oxygen is picked up from the placenta is delivering the oxygen, the umbilical vein is taking the oxygen, it is directly going into your right atrium, right? So then what happens? The heart pumps it to the baby's parts, and then they are leaving, the deoxygenated blood is leaving via the umbilical artery. There are two here. So the lungs are not functional when it is inside. So that is what you have to understand. This is another important thing for you, how the aorta develops, right? So a lot of things are, they undergo apoptosis, and finally you get this shape that you want. And when this is, because of this, the recurrent laryngeal nerve gets pulled down on one side. So let us look at the end of every chapter what they have given. Focus here, people. Some applied aspects are given for at the end of every chapter. Why exactly you are reading that kind of information, it is always useful. This is another important diagram that you come across, right, in your embryology. They can keep even spotters of this. The pharyngeal arches, right, in the cranial part of the foregut. Like I said, all these images should have one 3D and show where they are taking a slice. That would be very nice. So here they are showing you third arch, fourth arch. So this is first, second arch. So this is the arch, okay. And what is this blue color called? That is called as the pouch. So the arch is like that, the pouch is inside. So that's what you should know, very, very important things. And from this, there is a nerve, artery, cartilage. For everything, there's a nerve, artery, cartilage, right? So this diagram is telling you the derivatives of the pharyngeal arches. So you can see here, this is the cartilage of the first arch, cartilage of the second arch, the hyoid bone itself, the body is coming from one, right? The lesser cornu is coming from another place, is it? Okay, focus, people. I think that became too much for you. So this is embryology, guys. Cleft lip, cleft palate. So in this video, we wanted to review this book by Chaurasia, B.D. Chaurasia, Human Embryology, with multiple choice questions, edited by Krishna Garg. So that's it for now, guys. This book is useful, interesting. That's all for now. Bye-bye.